From looking at this radiograph, this panoramic radiograph, one can see that on the left side there's a bridge going from numbers 18 through 20, where 19 is the pontic. Now specifically on number 20, if you're looking at this radiograph right here, you can see that there's recurrent decay on it. So under this bridge there's recurrent decay, so this has to be the cause of her sensitivity.
Our purpose today is to treat the patient's sensitivity. The questions we would like answered are as follows. What is the most effective way to treat the patient's sensitivity? What is the most effective way to prevent the sensitivity from recurring again? And last, what adjustments, if any, need to be made to the patient's bridge to help alleviate the sensitivity?
Assuming that the patient is financially able, a new bridge can be made.
All clinical reasoning is done at some point of view, whether it's the doctor's point of view or it's the patient's point of view. In this case, Ms. Hattie May, the doctor can take either a conservative or an aggressive approach. The conservative approach would be to do a core buildup and re-cement the bridge. The more aggressive approach would be root canal therapy. Now, what is Ms. Hattie May's point of view? She's just in pain and wants some teeth back in her mouth. However, regardless of the patient and the doctor, all points of views must be considered in clinical reason.
The patient presents as an ASA Class 2 patient, which means that they present with mild systemic disease, which is well controlled. Now this is important because this is not a contraindication for our treatment of choice, which is root canal therapy. Based on the patient's complaint and the patient's symptoms, the proper standard of care would be to perform some endo testing, which consists of thermal testing, percussion, palpation, and a bite test.
Failure to treat this patient will lead to further decay, possible loss of tooth vitality, increased sensitivity due to a high chance of pulpal exposure. The dentist will need to give the patient thorough oral hygiene instructions, such as proper brushing and flossing, along with placing them on a minimum 6-month recall to ensure upkeep and prevent failure of the restored teeth.
As a healthcare professional, it is extremely important not to show bias to those in whom we treat. By making decisions based on our own opinion or assumptions, we do a disservice to whom we serve. As the dentist, it is vital to treat everyone with the same level of respect, dignity, and care in which they deserve. Some of the typical biases. Man, this patient can't afford this treatment. Man, he ain't even going to do what I tell him to do. He's not going to be compliant with this treatment or even take care of his teeth after I finish doing all this work.
Created using Powtoon.